How to treat and cure benign prostatic hyperplasia. In BPH, the prostate gland grows in size. It may compress the urethra, which courses through the center of the prostate. This can impede the flow of urine from the bladder through the urethra to the outside. It can cause urine to back up in the bladder, retention, leading to the need to urinate frequently during the day and night. Other common symptoms include a slow flow of urine, the need to urinate urgently, and difficulty starting the urinary stream. More serious problems include urinary tract infections and complete blockage of the urethra, which may be a medical emergency and can lead injury to the kidneys. Treatment. Benign prostatic hyperplasia, BPH, cannot be cured, so treatment focuses on reducing your symptoms. Treatment is based on how severe your symptoms are, how much they bother you, and whether you have complications. Deciding how to treat BPH is greatly influenced by how bothersome your symptoms are. Symptom Index is an interactive questionnaire that can help you tell how bad your symptoms are and measure how well your treatment is working. This questionnaire ranks the severity of your symptoms on a numerical scale. The higher the number, the more you are bothered by your symptoms. The more your symptoms bother you, the more aggressive you may want to be in your treatment. Initial treatment. The following treatment recommendations for benign prostatic hyperplasia, BPH, based on how bad your symptoms are. Symptoms that are mild or that do not bother you may be best treated by watchful waiting. This means you may make small changes to your lifestyle to control your symptoms. You do not take medicines or have surgery. You have regular checkups to be sure your symptoms are not getting worse. The treatment of moderate to severe symptoms, a score of 8 or more, depends on how much you are bothered by them. If the symptoms are not greatly affecting your quality of life, you may choose watchful waiting or treatment with medicine. If the symptoms are bothersome or you want more aggressive treatment, you may be offered surgery or less invasive therapies, such as transurethral microwave therapy, TUMT, or transurethral needle ablation, TUNA. Complications of BPH, such as ongoing inability to urinate, urinary tract infections, bladder stones, kidney damage, or ongoing blood in your urine, should be treated with surgery. You may also want surgery if your symptoms have not been helped with other treatments. There are some things you can do that may help reduce how much BPH affects your quality of life. Do not try to rush your urination. Try to relax while using the bathroom. Spread your fluid intake throughout the day. Limit fluid intake in the evening if you often wake up at night to urinate. If possible, avoid medicines that make your symptoms worse. Ongoing treatment. If your symptoms of benign prostatic hyperplasia, BPH, remain mild and not bothersome, watchful waiting may be your best treatment. With this treatment, you may make small changes to your lifestyle to control your symptoms. You do not take medicines or have surgery. You have regular checkups to be sure your symptoms are not getting worse. If symptoms get worse or become bothersome, or if you develop complications, you can consider medicine or surgery. Treatment if the condition gets worse. If any of the following occur, you will probably need surgery for benign prostatic hyperplasia, BPH. You cannot urinate. Your BPH is causing repeated urinary tract infections, bladder stones, or bladder damage. You have blood in your urine that is not getting better and is causing other problems such as clots that make it hard to urinate. You have kidney damage. You continue to have symptoms that bother you, even with medicine or other treatments. If surgery seems likely, and bearing in mind the age of most men who present with this condition, further questions to assess fitness for surgery may be in order. Urinary frequency is often a presenting symptom. Ask how many times a day he needs to void and how often he has to rise at night. Ask also if he passes small or large volumes of urine each time. When inquiring about urinary frequency, it is necessary to distinguish frequent passage of small volumes from polyuria. To this end, it may be helpful to complete a frequency volume chart. Urinary urgency may occur and manifests as a need to pass urine quickly for fear of incontinence. Hesitancy occurs when he has to stand at the toilet for a while before he can initiate micturition. There is usually a poor stream and dribbling of urine too, and he may stop during the act. Incomplete bladder emptying gives the sensation of still having urine in the bladder, no matter how often he goes. He may even be able to pass more immediately after he has finished. There may be a need to push or strain, increasing the risk of micturition syncope. Surgery. Surgery is usually reserved for those with a large prostate or failure to respond to an adequate trial of medical therapy. Surgery is required if there is acute urinary retention, failed voiding trials, recurrent gross hematuria, UTI, renal insufficiency due to obstruction or failure of medical treatment. Open prostatectomy, transurethral vaporization of the prostate, TUVP, is reserved for those with a prostate larger than 80 grams, bladder stones or bladder diverticula, and patients who cannot be positioned for transurethral surgery. The inner core of the prostate adenoma is shelled out, leaving the peripheral zone behind. There may be significant blood loss requiring transfusion. Open prostatectomy usually has excellent results in terms of improvement of urinary flow and urinary symptoms. Transurethral resection of the prostate, TURP, is now the standard technique. A working sheath is placed in the urethra through which a handheld device with an attached wire loop is placed. A cutting diathermy is run through the loop so that it can be used to shave away prostatic tissue. When successful, it is an excellent operation that does not involve entering the abdomen, but it can have complications. Bleeding may be difficult to control. Irrigating fluid may be absorbed into the circulation via cut veins. An indwelling catheter is required until bleeding has stopped. Urethral stricture can occur. There can be retrograde ejaculation after operation, or damage to the nerves can cause erectile dysfunction. Insertion of prostatic urethral lift implants may be used when the man wishes to have a procedure with a lower risk of causing sexual dysfunction. Holmium laser enucleation of the prostate, HOLEP, is equally effective, has a lower morbidity rate, and is being considered as first choice where available. Minimally invasive therapies usually involve heat destruction of prostatic tissue. Via the urethra, energy is transferred to destroy tissue, in the form of laser, microwaves, radiofrequency waves, high-intensity ultrasound, and high-voltage electrical energy. Transurethral incision of the prostate, TUIP, or transurethral needle ablation, TUNA, can be offered as an alternative to TURP for patients wishing to avoid, or who are unfit for, more invasive surgery. Both treatments, however, have a higher recurrence rate than TURP. If the prostate size is larger than 80 grams, this narrows the options to TURP, TUVP, or HOLEP. It should be noted that surgical options are unlikely to be definitive procedures. Newer techniques such as prostate artery embolization are being researched to assess safety and efficacy.